Assalamu alaikum. Good afternoon. My name is Ravi Mamtani. I'm a professor of population health and professor of medicine at Weill Cornell Medical College in Qatar. I welcome you to our ongoing population health and well-being series developed and implemented by the Institute for Population Health at Cornell in Qatar. The objectives of the series are: number one, discuss contemporary and critical topics relevant to healthcare, medicine, and population health. Number two, examine evidence-based practice germane to public health and patient care. Number three, describe opportunities and challenges in the evolving phase of healthcare. Before we get to the discussions, some housekeeping notes for your attention. Your cameras and microphones are turned off. Use the Q&A feature to type questions and comments. Questions will be addressed at the end of the session, and that session will be moderated by Dr. Sohaila Chima, also my colleague and faculty at Cornell in Qatar. This activity is accredited by the Accreditation Council for Continuing Medical Education in the US, and also by the Department of Healthcare Professions of the Ministry of Public Health. The couple of remarks on evaluation and certificates. The post-activity evaluation will be available in your Cloud CME account by April 12th, 2021. You will receive an email notification once the evaluation is available in your Cloud CME account. Your certificates will be available for download once you complete the post-activity evaluation on the Cloud CME portal. Now, the webinar. It is my pleasure and honor to invite my mentor, my senior colleague, and my boss, Dean Javed Sheikh, to introduce today's distinguished speaker for the discussion on battling the COVID-19 pandemic. Dean Sheikh, the screen is yours. Over to you.
Thank you, Dr. Mamtani. This is truly a very special occasion, and it's truly a pleasure and an honor for me to introduce my dear friend, Professor Dr. Sheikh Mohamed bin Hamad bin Jassim Al-Thani, who is a recognized leader in healthcare, not only in Qatar, but in the entire region, and truly is a star who's rising and bringing a lot of attention to Qatar. Dr. Sheikh Mohamed is also a very well-known academic and is an associate professor in our Department of Clinical Healthcare Policy and Research. In addition, whatever time he gets, when he gets, I have no idea. He is on so many committees, and among those, and I'll go through some of the committees later on, but on top of that, he is tremendously helpful to us on our admissions committee, where every one of our faculty member is full of praises for his sagaciousness, for his wisdom, and his cultural perspectives. Getting to the topic at hand, as Dr. Mamtani said, that Dr. Sheikh Mohamed will be addressing the issue of how the whole journey of how the leadership has contained pandemic here in Qatar from their perspective. And that would be really an inside story. And we are very fortunate to have that opportunity to hear from him himself. Dr. Sheikh Mohamed has developed over the years multiple programs to protect the health of individuals, families, and communities in Qatar. He has always placed a very high priority on developing the first public health strategy, which was introduced in 2017 and will go until 2022. He was very, very involved in that, in rolling out that public health strategy. He's also involved in conducting clinical research studies himself and overseeing them in the most ethical and safest possible manner to develop an integrated approach to health prevention and promotion. He has more than 30 scientific publications in diabetes, environmental health, road safety, communicable diseases, and obesity. Dr. Sheikh Mohammed heads many, many important healthcare committees of national importance. I'll just mention a few here. He heads the National Preventive Health Committee, and I mentioned that here because he, being a professor of clinical healthcare policy and research, this comes very naturally. This committee aims to address the many, many facets of changing the whole model of healthcare, transitioning from a curative to a preventive health focus. And this is something which is really going to transform the healthcare in Qatar, but that is the cutting edge thinking all over the world. And he and his committee will ensure a robust preventive health governance system to be put in place as the committee progresses. He's also the chair of the Public Health Implementation Committee and member in the National Public Health Committee. And as I said earlier, on top of that, he also is very active in our own admissions committee. So we are all looking forward to benefiting from his experience, from his wisdom, from his perspective, and to share with us how the journey took place and what they are doing and what they have done to safeguard the health and welfare and well-being of the population of Qatar. Professor Dr. Sheikh Mohammed Al-Thani, thank you. Please take over.
Thank you. Thank you so much, Dr. Javed, for the beautiful introduction. I appreciated this, and thank you all for the team, Dr. Ravi, and all the team who are here. And I would like to start, Bismillah ar-Rahman ar-Rahim. Dear colleagues, Assalamu alaikum wa rahmatullahi wa barakatuh. A good afternoon for all of you. It's really an honor and pleasure to be with a great college university led by great people today. And this is something I'm proud to be with you, and I thank even Cornell and the teams how much they support us during COVID. I believe many of you has heard about COVID everywhere internationally, but it's time to chance, like we are here as colleagues from Cornell and people related to public health in Qatar, to speak together about the situation from a Qatari eye and to keep us all in the same with the same view and discuss it and learn from each other in this meeting. So as a speaker, I have no relevant financial relationships to disclose, and I will not be discussing and labeled unapproved use of drugs or products. So we discussed the epidemiology today, as you know, part of it, and summarize the public health control strategy in Qatar to be oriented. What are we doing here in Qatar for people who are inside or coming guests from monitoring us from outside Qatar? As a college, we know that we have a content through introduction, we know the historical overview, and we'll go for all these 11 points that you can see here one by one and give it a chance to speak about. So as introduction, nobody believed what happened of unprecedented threats of healthcare system and the economy from COVID. It's been now more than 1 year. Nobody thought it will be as equal like before. You can see many countries now still having cases as it was 1 year ago, although they're vaccine. They were shocked. This is thing you don't see except in different 3 or 4 generation. Many people were discussing this for years, and now it happened. Everybody say it's overdue, and they waited for H1N1 to be the one, but was not the one. Now COVID-19 is the one and is putting the world in stress, and this brings back the old days of the public health importance for the programming and the power of public health to control this from becoming a catastrophe for a country like, God forbid, the old plagues and the other issue. And this is always a challenge, how to go between health and economy. So the historical overview is something to always to mention. It's the case started in the last day of COVID-19 as they agreed on in WHO, which gave her the name COVID-19, although all the suffering was in 20, not in 19. 19 was a good year, but it took the name in 19. And we can see how WHO was the fastest time to go in 10 days to say the risk of human-to-human transmission. And it declared that it's an emergency. And it waited a little bit more to say it's a pandemic when people were ready that it is a pandemic and crossing all the continents. It's something has been the highest in deaths and cases internationally. We can see it from the statistics. The deaths is now coming to 3 million in the coming month. At the same time, America has the highest cases, led by America and USA itself, and Brazil, Canada, and Mexico. And we can see here that these cases has been with the availability of testing. America was leading this, then Europe, then Southeast Asia, Eastern Mediterranean, and we can see Africa didn't have a chance for the high cost of the test, and they handled only the symptom cases in the hospitals. Here for our Mediterranean region, we can see the cases, how are the percentage. Always when you see high percentage of deaths, it means that case fatality rate, that means this case country, they don't test a lot of cases and kept only informing us about the deaths confirmed from the disease, while the countries with the lower have better chance to test more people and keep the case fatality lower, like Qatar and Bahrain and Kuwait. These cases you can see here with the percentage, Bahrain is around 0.4, but Qatar has been always the lowest in the case fatality rate due to, as much we can discuss it later, controlling the disease and proper healthcare in Qatar that we'll have at the time to discuss how is part of our preparedness. We can see here how the cases, the test in Qatar is being steadily increasing through the months. It was a challenge for us. The test, when we started, we can do only 1,000 a day. Then we keep growing this. We can do now around 25,000 a day. It's like 25 times, 25-fold. It's an achievement. And this is another reason why our cases can easily increase, because of the big scale of testing that we can do now. This is the situation of the cases. You can see it in our meter, how we have the first big wave. And now we are increasing again in the case steadily. So this is the plan why we close schools, just to focus on other things more than the schools. Most of the cases are not from schools, 95% from the community, but closing the schools can relieve the families and make them focus more on other things to keep protecting the family. Our cases has been increasing for the first time to the highest numbers ever since the COVID cases in May. And now we can see the infection, how it's grown. The 7-day average is near to, by this slide, to 1,000, and the daily deaths came to 4 cases steadily. You can see that before we have many days without any death, many. And now, sadly, we have some deaths due to this coming strain that we can discuss later. Qatar characteristics. People say about Qatar, or how Qatar can handle things. As you know, Qatar has been known that have high per capita, so we are responsible to give always one of the best healthcare, because I see Qatar deserve the best. This is our logo. So we always hope that we can make people satisfied and happy with the efforts that happen in health, although it always needs to be improved and upgraded. Unemployment in Qatar is almost nil, and this has helped us to control that everybody is productive in the country and add value. And 3 is Qatar benefit from a well-supported healthcare system in comparison to any affected countries, because we have most solidarities, 80 to 85% of the work happen between government and semi-governmental companies that make it more easy to monitor and handle through one system in Qatar. And Qatar people population age above 65 is low compared to any other country, which lower the deaths. So for the economy, Qatar has been known for was the highest economic growth in the world from 2000 to 2010, and it's mainly oil and natural gas that make us away from the risk that happened to the countries with a lot of tourism. And the resource of high economy per capita levels, high construction spending is always being working during even COVID, because we have a World Cup to catch. So what happened during this? It was a very special time that when the oil was sold around the world for a short time on zero price, just to take it from the market, and the oil price went down, and the Qatar economy went by 4.5%. But we are hoping that the economy will rebound quickly this year by 2.5, although 2.5 will not cover the loss that happened last year, but will put us on the track very quickly, inshallah. And I hope the World Cup this will be from the past. So about the situation in Qatar, as you can know, when happened this in Qatar, we have controlled the disease coming from the Far East for good time, for around 2 months. You know, January and February was all in Far East, we controlled it. But all of a sudden we were surprised that our neighbors, Iran, have many cases, and all of a sudden we found ourselves taking our Qatar people from Iran and found the first case between the people who stayed in the hotel Oryx Rotana, and the first case was from there. Then we surprisingly found that this disease has been in a cluster in workers in the vegetable market, and this helped us to understand that the risk of the industrial area that end by closing the industrial area for a short time to assure that nothing happened. And with the panic that happened around the world and the risk that everybody is vulnerable, we closed schools and universities and controlled very well traveling to other countries. Then here we started a very visionary leadership started by His Highness Sheikh Tamim bin Hamad Al-Thani, the Prince of Qatar. And this helped us to start the leadership from up to down with generosity in any capacity we need, anything that we need support, and we get the trust in health. And health, Ministry of Health was the leader on defining the main goals from this period, with the support of all colleagues from all the ministries, which help us to have solidarity for this thing. The first this happened after around 1 month from the first case, and it was sad for us to start having deaths in Qatar. So part of the help that helped us to keep going on during this period that Qatar has been building for a long time, steady steps, like we have the Constitution of Qatar, then we have the Qatar National Vision 2030. We were the first country in the world, maybe, or at least in the region, to be with Qatar National Vision 2030. It was before even the SDGs from WHO, United Nations. It was 2015. This vision helped us to go steadily to the World Cup, plus achieving different strategies like national health strategy, public health strategy, and all dedicated special disease like diabetes, mental health, cancer, and road traffic, and others. So the goal, the strategy that we work, and people were complaining this because we were harsh in this, we wanted to identify, isolate, and manage patients. The goal is that not everyone should be infected at the same time. We could control this disease by isolating the cases, that not everybody should be hit at the same time by keeping people at home. Maybe there was loss of some economical and trade, but to protect that not everybody is hit at the same time. We can control the burden on the health sector and protect people as much as we can. And we have even limited the international spread through controlling the people coming to quarantine. We accelerated the development of test therapeutics and ordered vaccine while we are from the rare country that gets Pfizer in the last year, not this year. And the communication information has tried to lower the burden of the rumors, although it's coming internationally to Qatar. We try to minimize the social economic impact through multi-sector partnership that every ministry should help understand the situation and lower the burden on every companies and people. The international coordination operation support, we are open, direct, always on Zoom and Teams with international WHO and the GCC Health Council. Then the readiness and operation was always upgraded, plus we accelerate priority and research and innovation. And we should like to thank here, while Cornell team has been leading this, Dr. Laytha Waradad and Dr. Ravi and the colleagues has been helping us so much in this research to keep leading. And we have very recognized papers from even Cornell that are linked from CDC, Atlanta, linked because it's so important about these starting points that guided many countries in the world. The Qatar National Response Action Plan has been, we scaled this managing risk preparedness as soon as possible, and we brought all the private and semi-governmental to help support us, plus the Red Crescent in Qatar. And we try to identify the nature and the virus and the clinical severity of the disease, which help us to take more brave decisions quickly, that not 2 weeks. If you are reactive, you can go only for 1 week yellow, rather to be on red, on ihtiraz. We decided to get people to 1 week for quarantine at hotel rather than 2 weeks after some time. And we keep trying to give new innovative ideas. We minimize the transmissibility and morbidity by having stronger laws for the masks and social distancing, and minimize the burden and support for health system by adding new hospitals like Ibn Said and Ras Laffan. They were never being ready, but by delaying the disease for 3 months, it helped us to open them and add value to be prepared even for the World Cup. We collaborated for our international partners with diagnostic therapeutics, and we got, alhamdulillah, what we need. Also, we suffered sometimes, but whereas people complain for low shortage, but we never have full emptiness. We always have the therapeutics needed or the vaccination. So the physicians are mandated to report. This is the goal was they need to mandate to confirm. Nobody can go out this. We have the identification, how to know people, and we're testing and tracing every case. This was the main reaction. We were always testing all the close contacts and the contacts at lower risk. Asymptomatic contacts even were quarantined for 14 days. And all contacts were being telephoned 3 times, and the investigation was a big deal. Other than testing people, we have surveillance and the screening, and plus investigating every case to understand where did this come from, and this helps us to understand the hotspots and the main areas of spread the infection in the long term. So the successful measures that have been done that we could in the first wave flatten the curve. You can see in the first wave, it was a bit higher between labors, but not all the labors. We could control Al-Khor and Al-Wakra. It was mainly in the industrial and in Doha for the labors. And the white collars and the Qataris have very low infectious rate that could help us to serve all the laborers community dedicated, of course, and build dedicated Hasm Barik Hospital, one of maybe the biggest ICU hospital in the Arab world, by around, it can handle till around 500 bed maximum with the tents there. And this has helped us to control the first wave. And now we are handling the second wave with the protection that happened with the natural immunity that happened last year is keeping us even handling it, or it will become more risky if this was not happening with the vaccination that we did. The organized governance structure, we have the prince above with the prime minister leading all the ministers, and we have Her Excellency leading the national committee between all the other ministries actions needed, plus the high strategic committee that I'm part of it, and we go to different tactical committees and SWIC and many other committees. This solidarity in the governance help us to understand and spread the information fast. The preventive and protective measures was there, always the protocols was done, and the quarantine isolation facilities is special. Very countries have, few have quarantine isolation facilities with like around, can handle around 1 or 2% of the total population in these quarantine areas. And we keep expanding our hospital capacity, plus innovative technologies that build resilience. And we can discuss like we have Kashif to make everything rather than paper-based on iPads, and plus Ihtiraz to control, and the support of Cerner for all the information as fast as we can, plus save the surveillance and vaccine electronic system that we have obtained with the support of Orido 1 year ago. And alhamdulillah, it started directly when we have this problem in last March. It was really on time. And even the government supported the community by 75 billion, a generosity for people who need to maintain wages and make people get the loans. And even it was enough and more than what we needed to keep this going on. Alhamdulillah, thanks for the generosity of the government. And adopt flexibility economic program. We understood to open and close, to give the chance for companies not to lose. Many people were worried that they will lose their work like other countries and go bankruptcy, but we didn't accept this. And we can see now the hotels are welcoming people coming from quarantine, and the restaurants are being working for the 9 months to cover the loss during this period. The rents was, many people have generosity to stop the rent for people for 3 to 6 months and exempt them from electricity and water fees. And again, we have a proactive, we have many, now we are working on proactive solution and mainly innovation, sustainable quality of life, plus technologies that have been mainly in Al-Usail, and we are learning to spread this more than Al-Usail to monitor any pandemics and to control any wrong habits or practices in these new cities. And we hope that keep this policy going on to be flexible when we know what to close, when we know what to open, and keep this as minimum affecting everyone. So if you remember, the main restrictions that help us to control this between people was mainly all incoming flights were stopped in March 18 to Qatar, except a few for the people who are Qataris, and few residents needed, like doctors and other people who are much needed to come. Transportation stopped, and people have started working from home. And for people who complain that we are suffering for 1 year, yes, but Imagine this came 10 years ago. It was H1N1, and we don't have this technology and Electronet or Zoom or Teams or other things. So we are blessed, alhamdulillah, that this came on a time that we already, especially in Qatar, this was come after a boycott for 3 years that make us having more strength and collective intelligence to work together. So although everybody has suffered during this period, everyone, but alhamdulillah, it's that came in a time that we can handle. As we say in the Quran, لا يكلف الله نفسا إلا وسعها. So I think we can handle it, although it is tough for many people. So all students have been distance learning during this period. Incentive of and for the financial sector happened. Extend water, exemption of rent, as we mentioned. And this meeting, we were meeting this in the CDC hospital building to assure that we are covering. We started the website, social media, and network hotline Ihtiraz. All these help us to start moving. We tried our best to keep connecting people through official meetings every month and see how things should be going and be as much transparent with people. Many guidelines was done in Qatar that help us that all the country work on the same page. Was praised from WHO and thank for their support in following up with us. So now the challenge is saying that whenever people say that this will go, this will die, inshallah things will become better, inshallah. But you cannot say that this will come and leave us easily. The disease is happening in many countries. Whenever the disease mutated to no harm virus, other places are still going on. So the world should always work together to assure this can be protected. The other challenges that was always that the access to medicine and vaccines, according to the Accreditation, was always a challenge. Sometimes they delayed our vaccines shipments to Qatar, but always with proper follow-up, we could handle. And I think this Doha Declaration trips has had many countries this honor from the world to get the rights to fairness between people has been working in the right direction, and we hope that it's going to keep growing and to help other countries. The aspiration for us to achieve SDGs is challenged because we learned a lot from COVID, but we need more time to deliver it after this delay from COVID itself, and ensure the universal coverage is happening all the time. As you can see, we said in Qatar, everybody who's above 70, 60, 50 should be vaccinated without color or religion or something. It's for everyone. This is our ethics that we want to always spread and build as part of the world. The supply chain was always needed because people doubted that the cold chain for vaccines and for the test and this, but alhamdulillah, we proved that it's working well. The misinformation and disinformation that's happening around the world, not only in Qatar, has affected people, even make them resistant to vaccines sometimes or hesitate to get the vaccine. And consideration of social determinants of health is always covered. We are trying now always to change the labor homes to be, now we are stopping the double bed in homes to lower the infection in one room. And the herd immunity should be 70% to be assured that we are good. But now maybe with the new strains, we should go higher than 70% to get the herd immunity and remove the masks. And this is a resistance of vaccine. Still, sadly to tell you that most people who are in ICU today or died, they didn't accept the vaccine. Sadly for that. People who are vaccines are very, 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 very low number from the total of people who died or are in ICU, especially with 2 doses. And even, I tell you, 1 dose help even from death. If people can get it, I recommend everyone to get his vaccine as soon as possible. It can protect life, inshallah. Emerging of COVID variant is a real trouble because I think Qatar has been doing well with the original one, and we got the UK strain, and we are handling, but there's another strains are appearing, and we are trying to work on. So this was our exit strategy that when we start exiting strategy in June, it was based on WHO that we can control the disease because we have tests, we have hospitals, and we know how to detect and test and isolate. We know the hotspots, mainly hotspots was usually industrial area and Abu Hamur and Busidra for some time, but they are bigger in a huge number of people, so they have higher case. So fixing them will help us to control more the country. The school and the workplace has learned how to get more, at least, to control the disease. And for a long-term practice, they have this awareness now to help them. And new cases was managed by quarantining people and education empowerment people to accept the new normal. So this is the flattening curve that we slow the flattening. And you can see we didn't have any high curve for around 9 months, and we hope this will come back soon. Regarding the vaccination, as you can see, we got the vaccination as early December 23, and people said we will not accept the vaccine without the health leaders vaccinate. So me and Dr. Al-Thani and most of our colleagues, Dr. Hamad has been vaccinated from the first day with the elderly to prove that it is safe. And what was our top thing when after 1 week, when His Highness Sheikh Tamim came and get the vaccine by himself. And this was a big difference to market for the vaccine, and people start getting the vaccine. Now we are more than 170, but I can tell you this week, inshallah, we'll cross the 1 million dose this week, inshallah. And we are hoping to keep going to Eid, inshallah, to be near to 2 million doses. And we are welcoming, we are starting, inshallah, the labors as soon as possible. This week we start the labors and everyone like above 40. And why people are getting more than 40, because death is under 40 was even much lower from dying from a car accident in Qatar. So we will vaccinate, but it's prioritization for the elderly as they are needing it more, especially that most of the deaths are usually combination of diabetes and hypertension, and usually one of the highest risk is renal failure. Renal failure end stage can be very high risk for life. And we have the QNCC. It's PHC is the leading part, but QNCC, which neighbor of Qatar Foundation. Thank Qatar Foundation for helping us to dedicate this place, beautiful, elegant place for vaccination, that's helping people to save lives by this initiative. So for the vaccination now, we have, again, we added the drive-through to make it more lovely for people. You are in your car and you get the vaccination, the second dose, mainly because you are tested and you are evaluated from the first dose. This helped us. We opened it in Lusail and in Al-Waqra, and it's happening now in all the private healthcare centers above 40, and healthcare and teachers and professors. All these can accept moderate chronic illness. We believe that many of them came, but we're still having around 30%. They are hoping that you can convince them we are vaccinated to get this. Our vaccination, as you can see, always slow but steady. We were increasing all the time by vaccine. Whenever vaccine came, we increase our capacity for every day. We are near to get a 1% of the per 100 people every day of the population. The second wave now, if you ask me what's happening in the second wave and people are worried, yes, the cases has increased significantly. Even we didn't thought that it will go like this, but there is a Boltzmann effect where people feel more protected and they are not much careful like the last year, and they keep going around and hanging between different groups, and this is affected the cases increase now in many of the, especially the white collar families, not in the neighbors, because they never have natural immunity has proven to be effective. But there's some strains that can lower the vaccine effectiveness and the natural immunity, but around to 15%. And so we thank again Cornell team that helped us to get for these deep data with support and align with Qatar University for understanding the type of the strains. So our now the case situation in the hospital is high. So please accept that we are going to have more restrictions now. We are now in level 3, but maybe we'll go a little bit more than level 3, because this is a challenge that we have been that to control the overburden on health and give the chance for everybody to get his treatment right. So the challenge with the new variants, they are the problem not for us, and the impact of them is not known yet. We are, God forbid, we didn't get the Brazilian in Qatar, and we want to make sure that keep protected. We don't know exactly the effect, but the Pfizer and Moderna has proven a very strong effectiveness, like 99% for point something for death, and even for infection is around 90% to get infection. Most of the people who are vaccinated, when they get the positive, they are always high CT. Many of them are 29, 30, 28. So they are very soon are not infecting the others, which is give us additional proof of the effect of the disease. So this is something we have like a paper done by this with our paper from Cornell. And what would we learn from Qatar? We learned that for other countries that the leader visions, investing to protect the country, and that smart technologies, proactive actions has supported us a lot not to suffer during the stressful time. The effective cross-sectional governance had happened through committees, and quick communication helps to get decision quickly. The accreditation healthcare system, we have GCI for hospitals, and we have the Diamond accreditation, Canada Diamond accreditation for primary health care. Plus, we are working on to be the first country outside USA to get the public health accreditation. Inshallah, in months, inshallah, we have to get it. Help us to keep things working. We have high quality academic support, like from White Cornell, Qatar University, and HPQ, and voluntary public participation. Everybody would like to volunteer. We get more than 30,000 want to volunteer with us. We thank them for this. The patriotic people have supported us a lot. The well-established international communication. We are always getting our international communication on time, in the same moment, plus new guidelines that will spread as fast through email and the country. The human resource policy, we have many decisions to hire people quickly and to allocate people from private or semi-governmental to the needed goals. Plus the advanced e-health, we have Cerner, SAVES, and Ihtiraz that make us always think promptly. Plus execution flows regulation was very serious by penalties that make people always not reacting through masks and social distancing. Plus the centralized, well-equipped ICU. ICU in one place has helped us to have the leaders together. Like many countries have the problem that they don't have ICU in every rural area, that affected chances of life and people who are living in the rural areas. So in the end, conclusions, at the global level, COVID pandemic and opportunities for partnership must be a collaboration to create effective networks, innovation, research. Qatar now is more interested to go more innovative, that we prove that it helps us a lot, and keep more investing in therapeutic vaccines. Rapid prototyping, any idea can be respected, and we try to make it to go to the light as soon as possible. A greater use of technology in communication and production help us now to keep communicating during this lockdown, and we be communicating and to keep the momentum going on. And we are confident that we will become stronger through this crisis, better prepared for the future emergency, and capable healthcare and public health system. And inshallah, like you see, the boycott and now this COVID will help us to have, inshallah, a great World Cup, country that has been grown through these problems, more wise, taking care, and a good role model for the world. Thank you so much.
Thank you, Dr. Sheikh Mohamed. I mean, truly enlightening presentation. When I was listening to you, and I'm thinking how difficult it is, and it's really hard to appreciate unless one listens very carefully to what you're sharing, which is how do you implement, translate abstract concepts of healthcare into multiple sectors, very complex coordination, and that's how you address the public health interests. And you guys have been able to do it phenomenally here. And really, we are very fortunate that we have very enlightened leadership all the way from the country to Her Excellency in terms of Department of Health and yourself.
Thank you so much, Dr. Sheikh Mohamed, for the wonderful presentation, all the questions that you've answered. And inshallah, you know, all of us living here in Qatar are with Qatar in fighting the pandemic. So thank you again. Dr. Al-Thani, any last thoughts from you?
Thank you, Suhaila. Just an amazing presentation. I have no words to describe the information you shared and how Ministry of Public Health has been at the forefront of battling the COVID-19, which I think sets an example for the world at large. So my personal gratitude to you for sharing your wisdom and thoughts. I also want to express my personal gratitude to Dean Sheikh for being with us this afternoon. I know how busy he is. Dean Sheikh, thank you so much. Shukran, and we appreciate everything. Dr. Sheikh, would you like to add?
I think you covered it. I am really full of gratitude for Dr. Sheikh Mohamed to make time and share with us how complex under the surface or behind the bonnet, or you know, all of these activities and efforts are. How easy it is to look at it on paper and in abstraction and say, okay, well, we'll just have this vaccination, everything will go away, and how difficult it is to coordinate across sectors and then coordinate throughout a country. So my hats off to you. Thank you.